During my second year of medical school, I was diagnosed with endometriosis through an endoscopic procedure. And when they did that, in addition to endometriosis, they actually saw my fallopian tubes were clogged. So when I found that out, I freaked out because knowing medicine, being a medical student, I realized that when I wanted to get kids, I wouldn't be able to naturally. Now, my husband and I were both medical school at that time. We had talked about having kids post medical school, post residency, post fellowship. But now, in this health condition and health state, I learned that technically I was infertile or would have to go through with assisted technology. Today, I'll be talking about my fertility preservation during medical school, my experience as a medical student going through ovarian stimulation with the goal to freeze my eggs and actually my embryos. I'll be reading a little bit from the blog and sharing context on my journey. The blog post is called Fertility Preservation During Medical School. And I'm going over this even though this was my second time that I went through follicle stimulation process to remove my eggs. But this is the time that, since I knew a little bit what was happening, since this was my second time, I was able to blog more about it and really explain my process. This blog post will go through this experience while I'm still in medical school. Week 1. I went into the fertility clinic, and the first thing they do is they get a baby follicle count. So what they do is an intravaginal ultrasound, which can get really close to your ovaries and look at what naturally, without any additional hormones, how many little follicles you have that have the potential of releasing an egg. So I have a picture of my ultrasound where you can see they're counting all the little follicles that I have. At first, I was just going to freeze my eggs, but after talking to the fertility specialist, who is an OB-GYN and specialized in endocrinology and reproduction, she said that since my husband's here, why not we just make the embryos and freeze them as like a just in case. So this is what we do, because the first round, I was only able to get one. And when you put them in for IVF, to actually see if they will attach the uterus and grow into a fetus, that not all the time works. So you have to have a good amount of them. So here's my second time I go in. I wrote a little thing. There was some emotions I had during my OB/GYN rotation, because at the same time I started this fertility preservation process, I was prepping, getting the medications ordered, calling insurance. That takes months beforehand. I was doing all that while doing my OB/GYN clinical rotation. It was really emotionally challenging. This is what I wrote in my journal. I can't believe the emotional roller coaster I've been through during this OB/GYN rotation. I've gone from pure joy and happiness to jealousy and sorrow. I'm frequently reminded of my own infertility and medical conditions like endometriosis. Sometimes it makes me want to jump to start having children just like them, especially when I am in labor and delivery and helping patients or their first moments where they're taking care of their child. So that was really hard emotionally. My upcoming stimulation reminds me I could place those little embryos in my uterus to start to grow. However, intellectually, I know that having a child right now is not financially nor cognitively good decision for me and my career as a physician, and also my husband he was a fourth-year medical student at that time. So he was applying to residency. There was a lot going on in his life too. I say, a last-minute surprise to embryo freezing. I learned I had to prepay the amount of 1 month's rent in order to freeze embryos, which is one thing not covered by the Illinois health insurance mandate for fertility and infertility treatment. This facility had me prepay before giving me the amount of medication I'll be doing during the cycle. During the previous follicle stimulation cycle, the hospital provided the bill at the end, which gave us time to plan how we were going to pay. But Thankfully, we were able to split the cost between 2 credit cards and then submit the medical expense receipts to the financial aid office to increase my student loans. You can do that for any medical expense that your insurance won't pay for if you're taking student loans, which is a godsend. Unfortunately, it took a couple of weeks to refund the money, so we were very close to not making rent. This situation demonstrates the social economic barriers to IVF and infertility care and fertility preservation, which I talk a lot about in other blog posts and other writing, just how ridiculously expensive it is to go through assisted reproductive technology. It can cost tens and thousands of dollars just to get these special hormones they have to inject, get all the doctor's visit, all the ultrasounds, do the procedure to remove the eggs, the procedure to put it back. It's so expensive. So individuals who have infertility or cannot reproduce on their own, whether because they are LGBTQ or they just don't have the organs or bodies, or they have had cancer before, they are going to have to use reproductive technology. And it's really sad how ridiculously expensive it is. So there is a lot of social economic barriers. These IVF medications cost $10,000. And I worked forever to get my medical school health insurance to pay for all of them until I found out there was a state mandate that makes insurances from schools or employments pay for it. That took a long time. It took a lot of energy, a lot of time, and a lot of tears. But like I said, I will talk about that in other podcasts, and you can read about on my website, medpsychmoss.com. All my writings are there. Next, pills. And I have a picture of me holding my estradiol pill, which is a form of estrogen used to increase estrogen levels and keep the ovarian follicles available for stimulation. So that was the first thing that I did. Now, I do want to mention, this is not medical treatment. This is not medical care. Every single fertility is different and their process, and each individual medication and stimulation is different. So please ask a doctor, ask a fertility specialist. This is my own journey and my own medicine recipe for my body. The first week, I took estradiol pills 3 times a day, which is TID, to increase the baseline of the estrogen in my system, which started pretty low. I freaked out when I realized these pills were not part of my previous acquired IVF medications. Thankfully, these little aqua pills were sent to regular pharmacies. So there are 2 types of pharmacy. There is regular pharmacy like Walgreens, CVS, that they have most medications that you do. However, for these injections and hormone medications, you have to sometimes go through a specialty pharmacy where they're super expensive and you have to go through all these hoops to get them paid for. Another nightmare. Usually it's super expensive, but I'm so glad that these estradiol pills, because they use them for other medical treatments, they're pretty common. I could just pick them up at my local pharmacy and my insurance covered it this time because I was prepared. Next, I talked about actually going in and comparing prenatal vitamins. On my first cycle, I kind of did vitamins, not. I was like, do I really need vitamins if I eat healthy? During that time, I was going through my leave of absence, so there was so much stuff going on. So I didn't really have vitamins. This time I was like, I'm going to make sure I get prenatal vitamins to get all my nutrients. When I went to the pharmacy, I was taken back because there are so many types. It seems that everyone had a different one. I took a picture of 3 different kinds, not advertising any of them, but each of them are slightly different, but they have most of the same vitamins. Do I go based on the percentage of vitamin? Do I compare which one has iron, which one doesn't have iron? Do I go tablets, gummies? Do I go by price? It was just, there was so much. And I'm in medicine. I'm a medical student. How in the world, if I struggle, how are other people that aren't in healthcare, how are they supposed to figure out? Wait, I thought prenatal vitamins are only if you're trying to get pregnant. not if I'm freezing my eggs or doing the stimulation. And apparently not. According to a 2019 review of studies on the micronutrient status, those are the little vitamins and little nutrients, the impact of preconception multiple micronutrient supplements on female fertility. And I linked to that in this blog post, this review study that looked at many different studies, looking at tons of different vitamins that are important when someone's trying to do egg stimulation. And this study found that adequate levels are important for oocyte quality, the baby egg, you can say, maturation, fertilization, and implantation, whereas antioxidants are vital to reduce oxidative stress, a process known to impair infertility. So once I found that study, I read it, I was like, okay, this is important. I should make sure that I start with vitamins because it's been found helpful. Okay, now how can I tell all the different types? So I did more research and I broke down what are these micronutrients they're talking about. One is folate levels, which are important for oocyte quality, maturation, fertilization, implantation. Next, zinc, which has been implicated in ovulation and menstrual cycles. Zinc and certain B vitamins improve DNA synthesis, which is fundamental in the development of the oocytes, like the baby eggs. Then vitamin A, which levels are a factor in oocyte quality and blastogenesis. The egg and the sperm, once they come together, actually growing and dividing in cells. Folate and zinc influence apoptosis, which is normal cell death, essential for regulation of follicle atresia, which is cell death, degeneration of the corpus luteum of the oocyte in the ovary that stays in the ovary after the egg is released. There is something called the corpus luteum that stays there and actually releases different hormones, specifically progesterone, to tell the egg to keep going. It tells the uterus to prepare for fertilization and implantation, and endometrial shedding, so having a menstrual cycle. Folate, vitamins B6, B12, D, and iron all have roles and mechanisms that could affect fertility, including homocysteine metabolism, inflammation, oxidative stress, and embryogenesis. One study found that folic acid supplementation in women undergoing IVF helped optimize homocysteine pathways in follicle fluid, which was associated with better embryo quality and a greater chance of becoming pregnant, which was a twofold increase of monofollicle fluid folate was associated with a 3 times greater chance of becoming pregnant. So in summary, folic acid was helpful to help people who are trying to get pregnant and for the embryo to mature correctly. I have the article linked, and I posted this by the CDC that really compares vitamins, why they're so helpful. 1 in 6 women is iron deficient during pregnancy, and it's highest amongst non-Hispanic Black women and Hispanic women. Fewer than 1 in 5 U.S. women take a prenatal vitamin containing iodine during pregnancy. Globally, more than half of children younger than 5 years old suffer from vitamin and mineral deficiencies. I didn't know that. Okay, let's go back to my journey. Week 2, injections begin. So the first injections were Menupur, and I actually created little videos that you can see on my YouTube page. A complicated mixing of different medications. Even as a medical student, it was so hard to remember how many times did I mix in, how many injections did I just do. It was very stressful. If it's stressful and hard for me as a medical professional, how is it for someone who doesn't do anything medical professional, who's scared of injections? This fertility journey is difficult. The biggest side effects that I put was exhaustion. Seems to me the main theme during this cycle, possibly because I was also doing a clinical rotation for part of it. Thankfully, my residents usually let us go early, so I usually got in an hour nap before dinner. Oh my goodness, I remember this. I think I was in neurology, And I was in neurology stroke care, and thankfully we did sitting rounds, so I felt less dizzy, but I was just so tired. And I had to wake up even earlier than I normally would to inject, to prepare. Like it took like good 10-15 minutes to prepare the medication, inject it, and then get ready for the rest of the day. Some people have to actually do injections at work, which is super stressful, or in medical school. As I've been more aware applying to residencies, I've been asking around what happens if you are breastfeeding. Only some places really are explicit or have a lactating room in a good place. Lactating rooms are a way that individuals can do those injections or take care of their health care. I really wish there were more of them and those were more accessible, because not all the time can you go from one side of the hospital to the other side of the hospital to take your medications or do a lactation and then go back. A lot of little things to think about when you're a patient and a doctor or a medical professional. This is actually from my journal that I wrote down. Ugh, I'm not feeling well. I have a headache. And I feel out of breath just from walking up a couple stairs. There's so much pain and swelling of my abdomen. It was just one injection this morning, but I feel like I've been doing them a lot longer. This was always super hard, especially since I had endometriosis. When I injected into my abdomen, I could get bruising, gas, or pain, and any type of movement, pressure in my stomach, abdomen area would just exasperate in pain because of my endometriosis. Then I actually have a picture of myself. I am sitting, looks like I'm wearing scrubs. I have a heating pad on my stomach. I have my computer where I was switching between trying to understand all the medications that change every single day. It was a very complicated schedule, probably studying world or doing some questions at the same time because I was in clinicals. I then have a picture of my stomach from the first cycle, but it gave a good idea of what my stomach looked like. If I was doing a physical exam on myself, I would describe my abdomen as diffusely tender with maximal tenderness in lower quadrants, voluntary guarding of lower quadrants, bruising surrounding the umbilicus, decreased bowel sounds, and no rebound tenderness. So a lot of big words, but it's the way doctors talk to describe the different symptomatology that I was experiencing. So if for some random reason you have that, it could be injections. And I have 3 different medications: Novarel, Menopur, and Leuprolide. Novarel is HCG hormone. Menopur is a mix of FSH and LH, so follicle stimulating hormone and luteinizing hormone. And Leuprolide is a GnRH agonist, so just the description of the mechanism of action of what those special names of medications are. So to deal with all this pain, I used a heating pad, took baths, took acetaminophen. I forgot this until later on, 81 milligrams of aspirin, because as your estrogen goes up, you have a greater chance of blood clot. So that's why they had me also do aspirin, but no ibuprofen, which was sad because I needed decreased inflammation, but we can't do too many things at once. And then also I have a history of stomach ulcers, so I try not to have ibuprofen. Next, I have a picture of my follicles. This one's after I've been going through hormones for a bit, and it says ovary 12, left ovary 11. So that's pretty exciting that my ovaries did have little baby follicles that were growing. Next, I wrote maternity clothes as an infertile individual. I purchased maternity pants, which don't have a band around my abdomen, which causes me so much pain throughout the day. No jeans, no leggings, and sometimes even scrubs I definitely can't have. A lot of mixed emotions while having to purchase these pants, while dealing with infertility and not having kids in the future. It's so painful to look at myself wearing these pants because it's not like I'm pregnant nor fat, just in pain. This is explaining when I wear maternity clothes, which was really hard that I had to get maternity clothes. when I was infertile and I wasn't actually pregnant. So very emotionally difficult experience to be going into a section where people are very happy and, oh, when's your baby? How, like, when are you due? And then I was like, oh, I'm actually not pregnant yet. And I'm actually not doing this to get pregnant right now. It was emotionally very hard. I would get these infertility pants, which was helpful because it put the least amount of pressure on my stomach, which, as I mentioned, was super bloated and painful. So I'd wear them on the days that I had the endometriosis flares during the follicle stimulation or just for my hypertonic pelvic floor pain. And this is what I wrote. It is emotionally painful and embarrassing to need such clothes because it makes me feel fat and makes me remember that I can't actually have kids naturally, that my bump won't magically become a baby and it will just be more painful. I also don't want people to ask how many weeks I am because I'm just in a flare. Doesn't look like much, but I feel like I am 3 months pregnant. I'm wearing black maternity pants and I'm wearing one of my school's Patagonia, so I'm probably on a clinic rotation during this. In reality, stuffed with little water balloons. It is actually not that far off, as many follicles in my ovary are growing to a goal of 18 to 20 millimeters or 2 centimeters in diameter. I have about 12 to 14 follicles on each ovary right now. From a medical perspective, I have to be careful not to twist, run, or overwork myself, which could increase my chance of an ovarian arteries twisting, which could cause ovarian torsion. And if you have ovarian torsion, unfortunately, it's most likely that they have to go in for surgery, untwist it, and remove. So don't want that to happen. And my first time I did this, I was so close to that happening because I had to pay for rent. I was in my leave of absence, so I couldn't take a sick leave off. And I was like, no, I need to do this. And I taught a Zumba class with feeling like this, feeling all bloated. I remember I was teaching a class and I just got this like sharp 10 out of 10 pain. I wanted to vomit. And that's when I realized, oh, that's why the doctor says I shouldn't do exercise or work hard or walk around a lot and twist. A lot of dancing and twisting because I could twist my ovaries. You have a massive ovary that can very easily flop over, twist, and cut off the circulation. Thankfully, if it did happen, it was momentarily and it was able to untwist, but that shock really scared me. And I was like, okay, I need to figure out how I can do this. Maybe not teach Zumba classes, just teach yoga classes or sitting Zumba classes for older individuals. I shifted around my schedule. But to think about it from a medical perspective, if you're in surgery, if you're a surgeon, you're twisting and standing for long periods of time. So it's really hard to do these fertility preservation or follicle stimulation during surgery. Also, if you're constantly having to get up and walk around the hospital and doing rounds, it's again really hard, which is a challenge because a lot of medical providers, specifically doctors, struggle with infertility. It's actually twice the amount. Actually, 1 in 4 doctors struggle from infertility when the regular population is 1 in 8, just because of all the stress, the older age of doctors by the time they start having kids. Not all medical students or residents can take time to do all these medical procedures. From an endometriosis perspective, the follicles were enlarging so much, they were touching my hormone-sensitive endometriosis lesions, which caused a lot of pain. This stimulation round, my doctor is following another regimen that's more slowly increasing my estrogen level, so it doesn't go as high as fast as last time, which we think is what caused me to be in way worse pain the first time I took it, and actually something called hyperstimulation ovarian syndrome, which I'll talk about. So I'm going to go to week 3. Continued injections, increased protein. I need to eat 10 grams of protein a day to prevent the rare side effect of hyperstimulated ovarian syndrome, which is when fluid leaks out of blood vessels into the abdominal cavity. I had this side effect last time I had my stimulation cycle, so I really want to prevent it this time. This time I prepared. Last time I was just like, oh, I'll make protein smoothies like just once a day, maybe twice a day. When I got sick of them, I'm like, I'm okay. This time I was going to make sure I had enough protein. So you can see the picture where I got tons of protein shakes, protein bars. This is how I broke it down in order to eat 100 grams of protein a day. For breakfast, I had 30-gram protein shake or a 10-gram latte and a 20-gram protein bar. The milk was probably where I was getting the protein there. Mid-morning snack, I would have a 10 to 20-gram protein bar. Lunch, I would have a protein-heavy snack, about 20 grams, so chicken, meats, eggs. Afternoon snack, 10 to 20-gram protein bar. Dinner, again, protein healthy, 10 to 20 protein. And then for dessert, I had a protein cookie, specifically protein. So much protein. And you did get sick after a while of it. I have a picture from Johns Hopkins that actually talked about the different proteins of all common foods, which was really helpful for me. Some protein-heavy meals were omelets, chicken, beans. I made chicken and bean enchiladas, bean and chili meat, and Greek yogurts with nuts. But it was still really hard to stay on top of eating this much protein. I'm eating when I'm not even hungry, which ended up making me feel all nauseated and bloated. Next, I wrote, is hormone brain a thing? If not, it should be. My little follicles were growing so slowly, which we did want, but also not fast enough because I wasn't following the medication recipe 100%, which is why I said this of hormone brain. I've been so stressed with school that I have messed up my injection cycle. I was positive I only had to take 175 units of Follistim each night, but then I realized that it was supposed to be 300 units. I kept making silly mistakes like this, and now I have slowed the growing of follicles and will not get them removed on the planned day. This messes up the rest of my week because I have planned meetings, clinic, and even a conference out of state I'm planning to go to. Now I just have to practice patience and wait for my next ultrasound on Monday to see how big my follicles are. That will help us determine and help the OB/GYN endocrinologist decide what specific day to remove. I was just so angry at myself that I messed up the regimen because I was working on such a tight schedule, especially as a medical student. Towards the end of the week, I started ganirelix at night, which was a GnRH antagonist. My estradiol had risen above 600, which is around the levels of ovulation. Therefore, this antagonist inhibited my pituitary, which is up here in the brain, from releasing naturally luteinizing hormone, leading to an LH surge, which would stimulate my ovary to ovulate. We did not want that to happen. We wanted to control my body. We didn't want my ovaries to naturally ovulate because we wanted to go in and actually remove them before that happened. So this told it to slow down. And I have a picture of me picking up one of the injections, and you can see my beautiful medication box with all my little injection medications, cleaning supplies, pills. I liked this box because the first time it was complicated to keep everything straight. This week's theme has been nausea, especially while in the passenger seat of the car. I usually do not like to take Ofran because it causes me the not so fun side effect constipation, which also impacts my endometriosis. It makes it so painful to go to the bathroom. But in this situation, I just had to do it. And I ended up taking it almost twice a day because I was so nauseous. I have a picture of me showing on my ultrasound a really nice follicle that hits the necessary 2 centimeters. So where we left off, week 4, removal week. I'll go over the removal week of what it felt like and what happened to actually go through, and what it felt like on that day of removal and post that day. 4 weeks to get through this procedure. Usually it should be like 2 weeks. That's what they recommend you put aside, but it can take up to a month to get your body fully ready to remove those follicles. I had 2 weeks off in my 3rd year of medical school, which I planned for the removal, but 2 weeks before that, I had to prep, taking vitamins, protein, getting my body ready, and started some medications. So I did start it, unfortunately, slightly earlier during one of my clinical rotations. To learn more about it, other blog posts where I wrote down a lot more information on why someone would go through follicle stimulation or fertility preservation. About 2 weeks before the actual removal, I barely slept because I couldn't find a comfortable way to sleep. While laying on my right side, my larger left follicles on my ovary would weigh down, causing a mix of sharp and dull pain across my abdomen because I have also endometriosis. I then seemed to wake up every couple hours to urinate because my bladder did not like the extra pressure and stimulation. I have a picture of my ultrasound where you can see my ovary that has big black circles, which means those are the follicles that have been stimulated with the hormones I've been injecting. On Monday, we counted 9 follicles on my left ovary and 5 on my right. They only count follicles over 1.5 centimeters or 17 millimeters in diameter because they have a greater chance of containing a mature egg. The follicle on the ultrasound looks like a big black circle because most of it is fluid. You can't even see which one on the ultrasound has an egg. Through research, they found that the ones that are bigger or have more likely a chance to have a mature egg, and it'll be better for freezing. I was like, I don't know what 1.7 centimeters is. So I put down to compare 19 millimeters or 1.9 centimeters is about a penny. And then 1.3 is about the size of a marble. It's between a penny size and a marble, so you can get an idea of how much those are. And if I had 9 of those, it's 9 little marbles because they're 3-dimensional. They're not flat like a penny. Think about having multiple marbles on each side of your lower abdomen. That's why it was so uncomfortable. Now, it's not always supposed to be, not everyone states that it's uncomfortable. Sometimes it just feels odd. But for me with endometriosis, it was very painful. Based on these follicles, when we added up the volume, it was about 22 centimeters cubed. I have a picture of all my follicles with the actual size and the estimated volume. Endometriosis symptom flare. I wrote, my current estradiol level is above 1200 and is the most painful, nauseating, and uncomfortable experience. Walking up the stairs to my apartment, which was on the 3rd floor, almost caused me to topple over. It was really uncomfortable, especially as I got closer to the dates that we'd go in and remove the follicles. That's where they recommend you not do extensive exercise. If I was in clinicals, I would have asked for accommodations to sit out, to do more note writing. That way I wouldn't feel so uncomfortable. But thankfully, I didn't need to add extra accommodations to my current accommodations plan. However, that is always an option and something I definitely would have pursued even more if I had probably thought about it. I didn't even think about it at the time. There was just so much going on in my life. But thankfully, I did have accommodations for my endometriosis by just saying, hey, I need to sit down. I'm going through a medical procedure. Everyone was really kind about it. And then if I wanted to disclose, I'm going through an IVF cycle or follicle stimulation, I was surprised how understanding people were, especially like female residents. They had gone through it themselves or they had friends who were going through, especially OB-GYN. That was definitely the easiest one to disclose. Hey, I'm going through follicle stimulation. They're like, oh, I get it. Maybe because they've done it or they have patients who go through it. Next section, delay in removal. After the ultrasound and blood draws, my procedure was rescheduled to Wednesday. That means Monday, I will do the leuprolide trigger shot. Leuprolide is a GnRH agonist, which tells the pituitary up here to release a surge of luteinizing hormone and follicle stimulating hormone to trigger final egg maturation and ovulation. Now, the goal is that they don't fully ovulate, so that the surgeon can go in and remove them right before they actually ovulate, because if they ovulate, just be lost in the abdomen or going through the tubes. Tuesday morning, I'll get my progesterone level again checked and might have to do a second leuprolide shot depending on my hormone levels. Thankfully, I didn't have to, because the day before the removal, I put down progesterone level is adequate. Yes. Spent the day relaxing and doing some TLC. Like getting a new haircut. And I have a picture of my new cute haircut that I did. That was definitely relaxing, especially if you're going to go through a medical procedure, any type of medical procedure. It's good to just relax and take care of your mental health. Next section, follicle removal day. So I'm going to walk through a time period of what it looked like. 8 a.m. I arrived, but this time it was a separate surgery center, which I thought was interesting because I've never been to a private surgery center before. I had a different clinic. Before, it was actually at the hospital I went to my medical school, so it was really weird to show up. At 8:30, I was taken back to the pre-op room, and then my husband also provided the sperm to the laboratory. At 8:45, I got a gown. I was given an eye with lactate readers, fluids to keep me hydrated, because I think I didn't eat for 12 hours before. And then I also had antibiotics because they're sticking a huge needle in. Any type of procedure like that can introduce bacteria, so it's always safe, and they always add antibiotics. I said this before, but I'll say it now. This is my own personal experience of going through infertility and follicle stimulation. This is not advice. This is not exactly what's going to happen to every person who goes through a follicle stimulation removal, just to share my own personal experience. At 8:50, I met with the anesthesiologist and the surgeon, which actually I was really sad that it wasn't the specific surgeon that I had closer relationship with, especially for these follicle stimulation. You just get whoever's on call. So every single day is a different surgeon from the clinic. You don't know exactly what day your ovaries are going to be ready. Not all the time, the surgeon that you met with, the fertility specialist, is going to be the same one that removes it. I wish it was, but unfortunately it isn't. At 9 a.m., I emptied my bladder for the last time and walked to the procedure room and laid down on the bed. Never done that before. I've always been carted in a cart. They had me walk into a little room, which was a little weird, but that's what happened. At 9:05, I was given anesthesia through my IV. I do remember that because I was even like asking, what are you giving me? Propofol, like naming all these different things. When I was a third year medical student, I hung out with the anesthesiologist for a bit because it was the best place where I could sit down or just talk instead of standing up and holding a retractor. That was just too much for my body. So it was really nice that I was there to combat my own fear. I started chatting with the anesthesiologist, like asking about what she was giving me. And then it was really awkward because I'm still awake when usually in the previous procedure, I don't even remember that happening. They definitely gave me the anesthesia before I went back into the room. This one was a little more awkward because up to this point, I had already seen a little bit what happens to patients who go in. I know that they would put my legs up in stirrups, and I was definitely pretty embarrassed and freaked out about that. Thankfully, the anesthesia could tell that I was just chatty, and she helped me relax and go to sleep easier. I helped them put my legs up in these massive stirrups, which went over your thighs and really spread you apart. It's stressful, and I can see how it could be traumatic if someone has sexual trauma. So be aware of that. Ask to maybe be put under before they do that procedure. It just gives them a better angle to go in with the huge needle. And at 9:30, I woke up and texted my husband that I'm dumb and loopy. I put an M, not an N. It was funny. And hey, that took 25 minutes for them to just go in, and remove it. I knew I was going to be in a lot of pains, and I was when I removed it. So I asked for a lot of heating packs, a lot of pain medication before they let me go, just because I knew that last time I did it, it was a very bumpy ride and painful. I remember the first time I went through this, I was very nauseous and in a lot of pain. That night, the first time, I ended up having, later on, I found out that I had hyperstimulation ovarian syndrome. So, like that night, I woke up in so much searing pain. I vomited and I felt very hot and I was having difficulty breathing and my chest was hurting. And I ended up going into the ER because I was worried that something was wrong. Maybe I had pulmonary embolism. Fortunately, I did not have a pulmonary embolism. Unfortunately, they could not figure out why I was in so much pain and not feeling well. It wasn't until the following day that I went to my infertility clinic for a follow-up check. And then they were like, oh, you have hyperstimulation ovarian syndrome, which means that there is a lot of extra fluid in your abdomen post the removal. And that's what was causing me so much pain. When I laid down, the extra fluid in my abdomen would push up on my diaphragm and push up on my chest a little bit. That's why I felt out of breath. So I didn't have a pulmonary embolism, just extra fluid from not having enough protein in my diet. Unfortunately, it's a rare side effect of this procedure. I wish someone would have caught it earlier, but lesson learned. For the second time, I made sure I ate enough protein every day and I really watched myself for those symptoms. I was so happy to find out that I had 30 follicles removed. And in those 30 follicles, there was a total of 23 eggs, which is pretty awesome. Compared to last time, I definitely did not have that many. I really think the last time it didn't go so well because the protein, I didn't have vitamins. I was under a lot of stress because the first time I did it, I was on my leave of absence. Look at my other podcasts on leave of absence to learn about all the stress, financial, educational that I was failing step one. Just so much stuff was going on in my life that it definitely had an impact on my follicle stimulation procedure. And stress can have an impact on your physical and mental health, and especially it can impact the amount of follicles you have. Because if you're super stressed, think about in nature, your body shouldn't be worried about making eggs to reproduce. It wants to just deal with the stress. So this time I was really careful with my own body, making sure that I was also taking care of my mental health. Even though I was a clinical medical student, I made sure that I had some time off where I could just relax and focus on these medications. I would have to wait a couple days to see how many embryos would form from all these eggs. What they did is after they had the eggs, they put together individual sperms. I didn't do genetic testing. You could do that. We might do it later on, but we didn't need it for this stage. The endocrinologist can take a little sample of those eggs or when they're together, the embryos, and actually check if there is specific genetic mutations. For example, if you have a gene that's dangerous and you don't want to pass on to your child, that could be something. Thankfully, we did genetic testing on myself, and I found that I didn't have any of those recessive, scary genes or any dominant genes that I could pass on. So there wasn't a need for us to do it at this time, but that is an option. So we did have to wait a couple days, and we were very happy to hear that 9 embryos were formed. Once those were formed, we had to wait 5 days to see which ones would actually split to progress into a blastocyst. That's been found that it's the most amount of small cells that have split to a proper form that can then be frozen and can be unfrozen later on at whatever time period you want. I was very happy. 5 days later, 4 embryos actually left to blastocyst stage. And I think 10 days later, I actually found out 9 went to blastocyst stage. So we were very happy about that because last time I only got 1, which was really heartbreaking, really sad. I wrote a blog post on it that it has like an apple because it was like my only embryo. It was really sad. So that's why I did this a second time. I have a really great picture on this blog post from my endocrinologist and fertility specialist that broke down why it's so hard and why you have to make so many follicles and so many eggs. She says that 1 to 3% of IVF follicles, no embryos will develop. And so that's why they try to get as many mature follicles as possible. And a lot of people have to do this multiple times because there's a less and less chance for an egg or an embryo to actually get to the next stage to be appropriate to either put into the body or to freeze. Post-removal week. There was still some pain around my umbilicus and low abdomen. So I did use my Intimate Rose pillow while driving. I took a picture of this really cool pillow that can prevent the pressure from the seatbelt. I had a conference scheduled in St. Louis. I drove some of my classmates the day after. And even though I didn't have ovarian syndrome, I still was not feeling 100%. I felt so bad for those other medical students. I remember driving and just getting so nauseous, and I started vomiting in the car while driving. It was so embarrassing. I quickly pulled over, grabbed my Zofran, which is medication for anti-nausea, went and got water where I could swish out my mouth and brush my teeth. It was just awful. But thankfully, I felt a lot better after that, and definitely wish that the conference was later that week, or I maybe should have been like, no, even though I paid for this conference and it's a really cool conference, I can't do this. I'll do it another time. I made a decision. And I guess that's what we do as medical professionals, especially as medical students and doctors, choosing our life versus our health versus our career. And the biggest thing I've learned throughout medical school is how important I have to put my health first. But even then, I do have to weigh the pros and cons and see if my health can take it and I can push through a little bit. But definitely, it's something I'm still learning and improving, and I hope I can do better during residency, valuing my health and knowing when is too much. And this is sad that I wrote this. No residency will want a pregnant patient or a new mom, which I wish I didn't write that because that is not true. There is a lot of stigma in medicine, but thankfully, a lot of specialties are really trying to support their residents, either having maternity leave, supporting their residents if they have a new family or if they are pregnant or just pregnant. But it is true. It is still a stigma, especially in fields like surgery or ones that they really depend on you and your time. They maybe can't support you if you need to take time off, even though it's a requirement by law. I wrote, I've already seen the mess it has caused other interns when they have to stress between breastfeeding and charting between patients. I did have an experience where I had an OB-GYN resident, a neurology fellow, a pediatric fellow, and psych intern who were different ones at different types during my third year that were breastfeeding. And they were so stressed, and it was really hard for them because they had to jump between trying to find a safe space to lactate. They had to find a place to keep their milk at the proper temperature. They had to wear special clothing so it wouldn't leak out into their clothes while taking care of patients. It was definitely hard for them emotionally. I'm not saying this to discourage people from having kids during their medical education. It does work. It does happen. It is possible. I have a lot of other students and friends that have gone through it and they've been successful, but it is definitely an additional stress. If you have gone through fertility or infertility during medical school or your medical education, or have gone through having a baby or doing IVF, I would love to hear your story. Please send me a message or email on medpsychmoss@gmail.com, or you can go through my website, medpsychmoss. I would love to have you on the podcast and share your experience. I can only share my own experience going through infertility and stimulation. So I would really love to hear your journey and share this experience, because this is unfortunately not talked a lot about in medicine. And the only way that we can break down stigmas and break down barriers is to talk about it. Please send me a message. I would love to have you on the show. If you haven't already, subscribe to the podcast wherever you're listening, whether that's Spotify, YouTube, Apple Podcasts, Amazon Music, or anywhere else. Make sure you also rate, because that helps other people find the podcast. You can also follow me on all social media at medpsychmoss. If you want to read more about this experience and my other posts regarding infertility, follicle removal, preservation, you can go onto this blog post and look at all the other things I've written at medpsychmoss.com. If you actually have infertility yourself, I have an amazing group of infertility resources that I have used, including clothing I've gotten, how I've stored my medications, things that I've worn in the car to help with the pressure, books, movies, videos, all these things that have helped me and I hope will help you as an individual living with infertility, or if you have a friend or family member who's struggling, you can share that on medpsychmoss.com/infertility. Thank you so much for joining in. Take care, everyone.